morning, the Rich Medical Practice. Vicky speaking.
I am very concerned, and I think we're going to have to call an ambulance to take you into hospital.
Are you okay? Is that hurting?
You with us, yeah?
You kind of like took a breath in and didn't breathe back out again then.
Just because modern medicine doesn't have a cure doesn't mean that we take it lightly. It can be very, very severe.
You're just going to have to be a bit brave, OK? Because I need to check the bones in your feet to see how they're doing. I'm going to check this one first.
And it will have to be as an urgent referral, OK? We have to make sure it's nothing sinister, and by sinister we mean the C word.
Good morning, the Rich Medical Practice, Veronica speaking.
Hello, can I help?
Hello?
Hello?
Hello? Anybody home? Can I help? Can I help?
That wasn't funny, that hurt.
Come in.
Good morning.
Morning. Come in.
How are you doing, all right?
I'm not so bad, thanks. Yeah, how are you?
Oh, not bad. I have problem with my back. Actually, with neck and the back.
All right.
That hip is a little bit higher, left side than the other.
Right.
And when you look at my neck, it's going like that. It's not straight. And I've got it from the early years when I was a kid, yeah?
All right.
But last couple of months, the pain in my neck on the right side, here between the beginning of school and end of the spine, it's so bad. And here at my back, when I sit like that, then I can't stand up because of the pain in the lower part on the right side, yeah?
Yeah.
I'm taking like 6, 7 ibuprofen sometimes a day, yeah? And the pain still hurts. The worst is the head, that side of the neck.
Yeah.
And I was thinking maybe high blood pressure, this and that, but I find out it's the neck, yeah?
So you said you had this when you were a kid?
Yeah.
Have you seen a doctor about it before then?
Yeah.
What did they tell you?
Nothing. Just keep exercise and that's it, yeah?
All right, well, that's good
But
advice.
that was when I was like, I don't know, maybe 14, yeah?
Yeah.
Now I'm 34.
OK. Right, let's have a look at your back.
Hiya, Demi. Come in. I'm Dr. Khan. Come and sit down. This is Zara, one of our students.
Nice to meet you.
Right. Tell me what's been going on.
Basically, I've had an unexpected pregnancy, but it's caused me really bad severe pain in this side, and it's like it's unusual because I've obviously been pregnant before and I've never had that sort of pain.
So this isn't your first pregnancy.
No.
How many times have you been pregnant before?
I've got 5.
5?
Yeah.
Oh, wow,
Last
OK.
ones were twins.
Your other pregnancies, were they normal otherwise?
I've had normal pregnancies with the ones that have actually been born, but I've had 3 miscarriages as well.
Oh, right, OK. So have you been pregnant 7 times in total? This will be the 8th time?
Yeah.
Right, OK, fair enough, fair enough. Any bleeding at all?
No.
No spotting, any discharge?
Yeah, I've had a bit of discharge.
What colour was the discharge?
Just normal white.
Like a whitey discharge, OK. And how are you feeling in yourself?
I've had a bit of a raised temperature over the past few days on and off. I just feel really exhausted.
Yeah. Any diarrhoea?
Yeah.
OK. Any, very funny question, any pain in your shoulder at all?
Yeah, just like here right in the tip.
Right.
Going through that's like there. It's just like literally on, do you know, like on your bone?
Yeah.
Going through.
I'm just going to ask Zara a couple of questions. Do you know why I asked about diarrhea and shoulder tip pain?
I know the shoulder one because it's referred pain.
Yeah. 1 in about 5 patients with ectopic pregnancies sometimes get diarrhea with it as well. And then the shoulder tip pain, if the pregnancy has ruptured the tube, if the tube has popped and that releases fluid into the abdomen, that fluid can irritate the phrenic nerve and cause pain in your shoulder. So it's always important to ask about those kind of things.
You are a bit curved, aren't you?
Yeah.
Is that relaxed? Your shoulders don't... Oh, right. You just got a little curve in your spine. Called a scoliosis. Is this tender up here?
Over here.
Up there? Right. Let me get up there then. It's no good when you're tall and I'm only 5'6.5". Just point to me on your lower back where you feel it.
Somewhere here.
Right. I'll tell you what we'll do. We'll just lie you down for that.
Down here.
Yeah. Oh, it's all knotted up, that. Your jazzy Merry Christmas pants on. Have I missed summer?
Yeah.
Yeah, that's all knotted up, that muscle in there. Right, OK, there you go. And what's your worry about this pain? You worried that it's something serious, or...?
But I'm not worrying about the bottom, I'm about the head, because sometimes I got such a badly headaches and pain in there. And when I'm moving head, I feel the pain. Only on the right side, you know.
Well, I'm not worried that there's a serious problem underlying all this, OK?
Yeah.
I think some of it is partly your posture, so when you're sitting like this, it puts you in an awkward position and it hurts. And some of it, you have got a slight curve in your spine, and that can sometimes predispose you to these sorts of pains. And plus, all your muscles up on your neck and your shoulders are really tight. Your shoulders are up here even when you relax. So I think what you need is physiotherapy. So I'll refer you to a physiotherapist and you'll get an appointment through to see them in the post, all right?
Doctor years ago tell me, oh, you need to do exercises, this and that, because the year's gonna go and it's gonna get worse.
And he was right.
Yeah.
There you go. Did you do your exercises?
Like that in front of...
Yeah, well, let that be a lesson to you. Serves yourself right. All right.
All right, thank you. OK, thank you.
All right, see you.
And when was your last period?
So I was due on beginning of April, so I'd all be about, I'd say about...
6 weeks?
About 4 to 6 weeks.
Right, OK, fair enough. Right, shall we have a feel of your tum? Do you mind just coming up on the couch for us? And you've done a positive pregnancy test.
Yeah.
When was that?
I only checked that, like, a few days ago.
OK, so if you just pop your arms by your side for us, we'll lift this up. How old are all your other children?
The youngest is 1.
Is it? And how old's the oldest?
6.
Oh, wow. Bet they keep you busy. Yeah.
That's really
Oh,
tender
I'm sorry.
You shot number 7. Number 8.
You say you're going to go to the toilet and biscuit, but time it takes you to get there and back. Maybe not.
Number 9 and 10, please. Who's next? Number 10, 11, 12?
Debbie, there's a few things going on here. I've had a look in your notes, and you mentioned this tube inflammation in the past. It was on the right-hand side.
Was it?
Yeah, so we always worry about anyone with any kind of tube inflammation, if they are pregnant, that inflammation has stopped the egg getting to where it needs to be, and that's an ectopic pregnancy.
That's where the pain is as well on the right-hand side.
Your blood pressure's low, your pulse is quick as well. I am very concerned that this is an ectopic pregnancy, and I think we're going to have to call an ambulance to take you into hospital.
Would I not be able to, like, get some stuff for home? Just let my partner know as well, because they ain't, like...
You can certainly let your partner know. The problem about going home from here before going to the hospital is there's a small chance that the egg gets stuck in the tube, and that can cause an obstruction, which causes the pain. But what then can happen is the tube can pop, and that can lead to some bleeding into your tummy, some fluid loss, and that can make you feel very poorly very quickly.
Yeah.
Now, normally I'm very nice and I let patients go home if they want to, but I think in this case I won't be doing my job properly if I didn't say you should stay here until the ambulance arrives.
Yeah.
Do you mind if I call the ambulance?
No, I don't mind.
Ambulance, please. Hi, my name's Dr. Khan. I'm a GP calling from the Ridge Medical Practice. I've got a 25-year-old lady here who's with a suspected ectopic pregnancy.
I've had really bad acne.
And I've tried everything, but nothing's working.
Right. I've had it for ages and I've tried loads and nothing's getting rid of it.
Can I have a look, please?
So, I mean, that's pretty angry, isn't it?
Somebody else in the family have troublesome acne.
So do you get sort of white heads and black heads and things?
It's just, I think I've got a bit of scab on it. Are you a picker?
Do you get any spots on the skin and you get any pustules?
That's another thing you see.
Even closer, because it's the spots we want.
So you've finished 4 months of treatment, haven't you?
You've had tablets and you've had cream.
The spots are really improved, aren't they, this time? I can notice a difference.
I know some people say, oh, it doesn't really matter, but really it does.
Come on in, have a seat. I'm Linda Eves. I'm one of the nurse practitioners. Hello. This your new little sister?
Yeah.
Oh, you lucky girl. So, how can I help you today?
Taya, she started puberty at 8-year-old, her periods.
Yes.
She's breaking out on all these, I think it's acne. I don't know, I'm not sure.
OK, I need a slightly closer look at your
But
skin.
they just keep getting worse.
OK, that's good. Well done, good girl. Lovely. A normal age to start periods is 1 to 2 years after the onset of puberty, often around 11 or 12 years. Usually in girls there is no abnormal reason for early onset puberty. Occasionally it can be due to a hormone imbalance. It can be a time where they might feel embarrassed or self-conscious because they're developing earlier than their friends, and they might struggle to cope with mood swings, acne, as in this case. OK, have a seat, my lovely. Taya has been referred to a paediatrician and may need a little bit of support, perhaps from the school nurses or family and friends. I'm going to give you a cream to put on. Because you're quite young and your skin's quite sort of delicate, maybe for the first few days, just put it on when you come home from school, about 4 o'clock, something like that, and then wash it off before you go to bed, so that it's only on sort of 4 or 5 hours. And then when you get used to it, when it starts to work a little bit and you tolerate it, then you can put it on before you go to bed, leave it on overnight, and then wash it off the next morning, OK? With treatments for spots, especially in puberty, that sort of thing, it tends to be a question of sort of managing it so that things are OK and sort of quite calm, not too flared up. And it might be that you need to use a little bit for a few weeks. You could try stopping, and then if it flares up, use it again. Just see. There are alternatives as well, but I think this is a good place to start and see how you get on with it. Is that all right? Yeah, that's fine. OK, there you go, my love. You can take that to the chemist and they'll sort you out with that. All right, nice to see you all. Nice to see your little sister. Bye.
So, Jess, we're going to play a game of I Spy.
OK.
I love this game.
OK.
So, I Spy with my little eyes, something beginning with L.
Do we get clues?
It's
5 guesses and a clue.
OK.
L. Like.
Yeah. Somewhat easy one for you. Go on, your turn.
Oh, hello. Thank you. Hi. Hi. This is Demi. She's 25 years old. She is pregnant, about 6 weeks. She's had pain in her right iliac fossa, bit of diarrhoea, some right shoulder tip pain. Blood pressure's a little bit low, 94/62. She's tachycardic at 120, apyrexial. And, yeah, she's got risk factors for an ectopic pregnancy as well. I spoke to the gynae team at the hospital. They're going to meet her in A&E.
In A&E?
Yeah.
OK. So you normally fit them well, yeah?
Yeah.
Yeah. I'll have a proper read through in a bit.
Your heart's working OK, Demi. That's a good sign, isn't it?
Yeah. If it wasn't, I'd be worried.
It's always a bonus, isn't it? Yeah. I mean, your blood pressure's all right now. It was a little bit low earlier. Do you want us to take you out in the chair or do you want to walk?
I'll walk.
You sure?
Yeah.
You sure, Demi?
Yeah.
OK.
Sure.
You'll be all right, Demi, and come and see me afterwards,
Yeah,
OK?
definitely,
Regardless
yeah.
of what happens, and we'll have a
Make
talk
an
about
appointment.
things. Good, good.
Thank you.
No worries. All right,
Nice
thanks,
to meet
mate.
you.
Cheers, bye.
Cheers. Good luck, Demi. Thanks. Bye-bye.
I spy on my little life. Something beginning with T.
T.
Were you tired yesterday?
No, not really.
Table?
No. Are you feeling all right now, then?
Just hot.
Tank?
No. You're feeling better now, aren't you? This is the problem.
Top?
No. You're trying to remember what we're wrong.
Tell me.
Telephone.
You picked the hardest one. Well, mine starts with S.
Right. Toe.
That's it.
Right, tell us a bit about it.
Last week I like with swimming, there was a load of like skin there which
Yes,
went
you can see
white
it's
and
all
then
peeled
fell
off.
off.
Yes, yes. I mean, it is ingrowing a little bit, right in the corner there. We can do an operation today, and I think that probably would help, although the operation itself is uncomfortable and the recovery time is, you know, several weeks, really.
Just do it.
Get rid of it. OK. So what that would involve is a series of injections up here, which do sting for about 20 seconds, and that numbs the toe, and then we remove the offending part of the toenail, we'll cut down here and remove it completely, and then use a chemical just to stop it growing back. It does take a bit of time to recover, as we talked about. Any cut can get infected. It's unusual. It's ointment or tablets that will settle that down. And these things are quite common and they can come back, unfortunately.
Right, well, I know it's...
Any questions you want to ask before we fill in the form? OK, let's just get this done then.
Have you thought what it is yet? This?
No. Can I have a clue?
No, because you haven't even had 5 guesses yet.
So tell me, what's happened with Mr. Patel?
Since Tuesday,
Yeah.
He's got very shivery cold.
Yeah.
And then he started with the fever.
Tuesday, 6 days ago.
Yeah.
Yeah.
And then I give him paracetamol, and then he on and off temperature every day.
Okay.
He's not eating much, you know. He's not allowed to drink much because of his dialysis.
Right. Okay.
He's restricted to the.
Any other symptoms? Sore throat, cough?
His nose has been running, and it's
Temperature.
Yeah. Does he normally? This looks like a cold sore. Does he normally get cold sores?
No, it started after this temperature.
Right. Okay. Do you normally wee, Mr. Patel, with your dialysis or not?
No.
Yeah, the pulse is fine. The oxygen is normal. That's good. Okay, let's have a listen to the lungs, if you don't mind.
No.
When is the last time we took any paracetamol or anything like that?
I think last night.
Right. Sure. You make a very good nurse. Thank you very
I've
much.
been doing this for 12 years now, you see.
You're expert, huh? Thank you so much.
Breathe in. Swas levo undo.
Yeah, sounds fine. Lovely. Can we have a look in your throat?
I don't think it can open wide.
Yeah, no, it's okay, it doesn't matter. The throat doesn't look too bad. Yeah, the chest sounds clear, actually. So this sounds very much like flu. I think he's got proper flu. Now, it doesn't mean flu is not something mild. It can be very, very severe. But unfortunately, antibiotics don't help flu. And there's no sign of a bacterial chest infection that would respond to antibiotics. His nose looks very manky, and this looks definitely like a cold sore, but it also looks quite infected. And I wonder whether he needs some cream for that, but it's not going to help his chest or anything like that, unfortunately.
But what about his temperature? You know, that's on and off, on and off.
Yeah. So that's part of the flu. So you need to keep on top of the temperature with regular paracetamol. So this morning he's missed a dose, so we need to give that to him. Yeah? It doesn't mean I'm not worried about him. Flu can be, in the young and the elderly, flu can be serious. Just because modern medicine doesn't have a cure doesn't mean that we take it lightly. Do you get me?
Yeah. I do, but I don't need it.
This is flucloxacillin antibiotic for his nose, here. But it's not going to help for the flu. See how he goes for the next couple of days. If we're getting worse and worse, please, you must bring him back and we re-examine. But don't wrap up too much. You're wrapping up too much. It's making you hotter.
Oh, no.
Temperature. Too much temperature. OK? Tablet. All right. So if he's unwell, you bring him back to the emergency clinic. So that means we will see him same day.
All right.
OK? All right. Bye-bye.
Who's next, please?
Could you make an appointment for a stitch removal for next Monday?
I spy with my little eye something beginning with H.
Right, are you set? Just bear with us, a scratch and a sting.
Okay.
I'm sorry, it's a series of injections. It's what we call a ring block.
Like a dentist, isn't
Torture,
it?
really, isn't
Hey?
it? I know.
Well, you're a toughie.
Well, it's needle blunt.
Yeah. Right, I'm just going to test it now, OK. Karen, can you reach the light by any chance?
Yes.
Thank you. Not sharp.
I can just feel something, yeah.
You'll feel pulling and pushing, but it shouldn't be
yeah.
sharp.
Is that better for
That's
you?
much better, thank you. Are you going to watch?
Not that bothered.
Okay.
If I don't like watching, I'll shut my eyes.
Good idea. That's what Karen and I do as well.
Yeah, we're like that.
Yeah, no. Do it by feel.
Yeah. You'll feel a bit of pressure, probably.
You okay?
Mm.
What are you planning on doing today? Is that hurting? Is that sharp?
We'll just give it a bit longer.
I can feel that.
Right.
Yeah.
That was probably one of the worst bits.
Oh, very good.
Are you okay?
You with us yet?
Right, have a seat. What can I do for you?
Week last Friday, I went to the pub. I didn't feel right well.
All of a sudden, I just feel like dizziness and then I just can't stand up.
It's a feeling of like I'm almost not there.
My vision goes kind of blurred.
While lying in bed, I feel the whole bed is rotating.
OK.
In fact, I fell into it well on the day, didn't I?
Yeah.
You didn't black out or anything like that?
No, I didn't black out, no.
If you can just follow my finger with your eyes.
So I'm going to ask the obvious question. Had you had a skinful?
No, I had 2 pints.
Okay, any sort of dizziness or any double vision from that?
Yeah, it was a bit blurry.
We'll give you some medications to help with the dizziness, OK?
Let's wait and see what the blood test results show, because if they're all normal, the chance of it being anything really seriously wrong in your head are low, all right?
We'll soon have you right.
Are you okay?
You with us yet?
Oh, yeah, I'm still here, yeah.
Yeah. You kind of like took a breath in and didn't breathe back out again then.
Oh, well, wife says I do that, but
Really?
I've never been tested. What is it, sleep mania or something?
Sleep apnea?
Yeah.
Oh, does she? While you're asleep in bed?
Yeah. That's it then.
That's it. It was a bit ingrowing, yeah.
That was quick.
Oh, we don't hang about here.
It seemed really quick.
So we just leave this chemical in for 4 minutes, and that stops it growing back from that corner bit, hopefully. But that should be it for you. Should get rid of it.
So a week today, you need to make an appointment to have your toenail dressing changed, OK? And you also need to keep it dry, so it's going to be a bit awkward for a week, keeping this dressing on.
No.
OK? Sticking your foot out of the shower.
We just hope it doesn't rain then, don't we?
It's supposed to be nice. They're talking about mini heat waves and things like that.
Stop it getting wet.
I know. Right, so I'm going to put you this lovely dressing on now.
OK, sir. We'll leave you to it then, all
no,
right?
thank you.
Any questions you want to ask?
No, it's...
All right.
I don't think so.
Good stuff.
This is the exciting part now. Look at this. Did you expect you were going to go out with this giant bandaged toe?
Well, an idea that we wouldn't. Will that stop on then?
Yeah. Well, I've been doing it for 7 years.
Oh, no, that's all right.
And I think this day on. So you're keeping this on for 1 whole week. Keep it dry. You lift your foot for me? We're done? You're right.
Believe so.
Yeah? Just this way. If you go through there and I'll get the next door.
It's an object.
Begins with H.
Yeah.
Hallway?
That's not an object.
I know.
No.
Hi, Days.
No.
I'm the calm boxer.
Come in. Hello, hello. Hello, Musa. Come in, I'm Dr. Khan. I'm Musa's mum. Come and sit down.
Thank you. Musa, you stay. Thank you.
Right. I think the crutches are giving me a clue, but tell me what's going on.
Actually, he just had an accident in school while he was doing his PE. He fell.
Okay.
And that happened last week on Thursday.
Yeah.
School called us. We took him to A&E because his foot was about this big.
Was it? Okay.
Swollen, yes.
Yeah.
I have 2 bubbles.
2?
Tennis ball, probably.
Tennis balls.
Tennis balls, right, OK.
They did do the x-rays. Luckily, he hasn't broken the bone. It was just a sprain. They advised us not to put any pressure on the foot, which we did. But he's still got a swelling around his foot.
So, Musa, tell me what you were doing in PE and how it
In
happened.
PA, we were actually playing rounders, and I went down the stairs and my foot twisted on the bottom stair, and then I started to roll over and I couldn't move my foot at all.
Right, they must have changed the rules in rounders. So when did you start using steps in rounders?
No, because you have
open field,
Right.
and he ran after the ball. I understand, probably.
So you had to go down the stairs to get the ball. I'm with you. Right, OK, fair enough. Did it swell up straight away?
Straight away, yes.
Right, OK, OK. Right, let's have a look at it then, shall we?
Okay, I'll just
put my crutches to the side.
Oh, sorry, Musa.
Oh, it's still swollen, isn't it? Right, Musa, you're just going to have to be a bit brave, OK, because I need to check the bones in your feet to see how they're doing. I'm going to check this one first. How does that feel?
It hurts a bit, but where it hurts most is underneath the ankle.
I'm just going to squeeze your calf at the back. How does that feel? That's OK?
Yeah.
Yeah, and I'm just going to check your tendon at the back here.
There's only a tiny bit train.
OK, but it's more around there, is it? OK. Just give me your toes a wiggle. Can you feel me?
Yeah.
Doesn't feel numb or anything like that?
No.
OK, good. Right, I'll let you put your shoe and sock back on and then we'll have a little think about things. Do you have any brothers or sisters, Musa?
I have 3 brothers.
OK. And what have they said about your foot?
Oh, sorry, baby.
They said it looks really swollen, you should check it out.
Yeah. Sometimes with children's bones, fractures themselves can be quite difficult to see. You are more tender on the bone when I'm pressing than I would like. I'm not convinced it's a fracture, but I can't say 100% it's not a fracture, in which case I would like to send you back to hospital to have an x-ray done, and I'll give you a form that you don't have to go through A&E or anything like that. I will get the results back. If it is a fracture, they normally send it back today. If it's not, it might be over the weekend. I often check my results over the weekend at home, so if it is anything worrying, I'll give you a call over the weekend.
Right.
All right, OK.
That's fine.
Does that seem fair to you?
Yeah.
Right, so the x-rays get done at St Luke's Hospital. So you just go there anytime, Monday to Friday, between 9 and 5. If you can go now, if it's lunchtime at school.
Yeah, we'll just take him there.
And then I'll...
He's fasting anyway.
Oh, are you? Good lad. Right, if I hear anything about the x-ray, as soon as I know, I'll let you know as well.
Brilliant, thank you
Keep
very
off
much.
it until I get that x-ray result back.
OK, thank you.
Yeah, nice to see you both. Cheers. Take care.
Bye. You take care.
You too.
Age? They all look the same, but they have different identity.
Humans?
No.
Right, what's going on?
I'm here today because I've been getting these really bad skin rashes and like skin reaction. I've got pictures.
Can we have a look in a bit? I'll ask you a few questions, but thank you for those. We'll definitely have a look at those in a second. So, tell us a bit about when did it all first start?
I've had them when I was younger, like 7 or 8, and then it went away for years. But starting this year, about February, it's been coming back really frequent, like every few days.
Right.
It's really irritating and itching. In school, sometimes it happens on my hands, so like when I'm writing in class, I can't, and it's really distracting.
Because it's itchy and...
It's itchy and stuff, yeah.
Right, OK.
Sometimes my joints hurt when I like, when I go like that.
OK, and how long does it last for when it's there?
If I don't have the antihistamine that they give me, it'll stay for about 2 hours.
OK, and then it just, it settles completely?
Yeah.
Or does it, yeah, right. And is it always in the same part of your body? It moves around, it can be anywhere?
Everywhere. It comes on my arms, my legs, my neck, my face, my thighs, my knees.
Really?
And my feet too, yeah.
All right, OK. And have you noticed any pattern to this? Anything that could trigger it, or...?
It's very random.
Very
And is there anything to see today? Have you got any patches now?
No, not today.
No, OK. But you've got some on your phone, which is helpful. Would you mind if we have a look at those then? Which is a good one to look at?
This one's...
Right, OK. Right. Oh, yes. Do you mind if I just zoom in a touch? So it's sort of quite raised, isn't it, and itchy. I mean, we call these sort of wheels. Right. Well, thank you very much for showing me those. But there's nothing to see today. Would it be all right if I just gently, with the back of this pen, just give you a bit of a scratch, and then I just want you to see how you're going to react to that whilst we're talking, OK? Okay, we'll just see if you get a reaction, because we were expecting no reaction. But sometimes if you've got an accelerated response, then you might get a
I
reaction.
did take an antihistamine this morning.
Did you? Okay,
so...
the fexofenadine.
Yeah.
Yes, okay. I mean, this sounds very much like urticaria, and the pictures very much are indicative of urticaria. Have you heard of that term before?
Yeah, it was like hives.
Yeah, yeah, exactly. And it's quite a common condition that's sadly poorly understood, really, and it's not thought to be so much an allergy, but an exaggerated response to normal activity within your bloodstream, really. And we've got lots of chemicals going around our blood, and histamine controls a lot of the messengers between the different blood cells, and if they just get a bit exaggerated, then they go a bit crazy and they cause these red reactions. The treatment is really to try and switch off your histamines, try and reduce how sensitive they are, really, and that's what the antihistamines do. And the fexofenadine is a pretty good one, and what we try and do is we try and dial back your immunity, so we want to try and stop how often you're getting these, so that everything just becomes less sensitive, and then gradually, with time, you just get less and less of these, and then you can stop taking the tablets, and hopefully it'll disappear.
Settle down.
That's the intention, yes. So there's not much going on there, is there? You can see I haven't got anything, neither of you, so I'm pleased that you haven't done that. So foods, things you come into contact with, very rarely cause this, OK? You are 16, aren't you? So you can have the adult dosage, and we would generally go for 3 of the cetirizine a day. OK. Now, where are you at with exams and things?
They just started now.
Just started. Right, because the downside of any antihistamines is that even though non-drowsy ones, they can still make you feel a bit drowsy. So we have to balance how much this is affecting your life with how much you need to study and how alert you need to be for your exams and general day-to-day stuff.
Yes.
So if you like the fexofenadine, then that's OK to continue with the fexofenadine, but maybe we'd go for the fexofenadine as well as maybe 20 milligrams of the cetirizine, one at one end of the day, one at the other end of the day. And then I'd like to see you back in maybe a couple of months' time to see how you're going. OK. Is that all right? OK, no problems. All right, OK. But we will be able to hopefully, get on top of this, OK? But it will take a wee bit of time.
Yeah. Thank you.
All right, OK. Good luck with your exams.
Thank you, bye.
See you later. Bye-bye.
Let me know when you give up, because then I
think I've given up.
3 clues.
I've given you 3 clues.
She
Yes,
said
I
about
have.
got their own personalities.
Got the hard drive.
That's not the hard drive. The hard drive's inside. Duh.
Over the last month, I've lost so much weight.
OK.
And my lung just there, hurting.
It's hurting.
And I've got a bit of a sore throat, but it's so, but I can feel it.
OK.
Especially when I'm drinking hot drinks.
OK. Does anything get stuck or anything in your throat?
Yeah, my tablets will start getting stuck for one.
How about food? Any food? Or anything?
Yeah, it does.
OK.
I'm not eating that well, to tell you the truth.
Okay.
Not at all, really.
Just your appetite's not great?
Not great at all, no.
And you've noticed weight loss. Have you actually examined your weight, or is it more the clothes feel a bit looser?
I know my clothes are loose because these I had to put away about 18 months ago, and I've had to get them back out again because I've lost that much weight.
Any indigestion or burning?
I am getting indigestion. I do get heartburn tablets, but...
Normally. But despite that, it's getting worse. OK. And how's your bowel habit like?
It's not right good neither.
So what's not right good? What does that mean?
With weeing.
With wee, for number 1 you're talking about?
I'm always,
Always weeing a lot?
A very lot, yeah.
Do you get up in the middle of the night to wee?
Yeah.
OK. How many times do you get up in the middle of the night to
2.
wee? Twice, OK. Any burning or stinging when you're weeing?
No, not really, I can't say no.
I think what we need to do really is get an up-to-date weight, if that's OK, and I need to examine your tummy. Because you've mentioned that your waterworks is not quite great and you don't really have any sort of burning or stinging, sometimes a prostate issue can cause us to wee a lot more, particularly at night. So we would probably need to examine your back passage as well, if that's OK, because of the nature of the examination, because it's intimate. We'll have to get a chaperone in for that part of the examination. Would that be OK?
Is that today?
Yeah, if you'd allow me to.
I've never let anybody do that before.
Normally see with the interpreter, or?
No.
interpreter.
When folk don't have English as their first language, you've got to be patient.
Do you want to take a seat? It's at 8:30. 8:30. Do you want to take a seat?
Yeah.
Thank you.
Does it feel normal?
No, I understand this.
I have difficulty with Punjabi, so I think it's better if you can translate for us.
Can you speak Urdu?
Speak English. Your English is absolutely fine.
Who's it for my sister? Yeah.
Oh, she said it's so painful.
You would like to ask about the side effect?
Yeah, good question.
Does it ever swell up?
No.
No.
We definitely look forward to see you. We want to look after you and try and fight this together.
Yeah.
What can I do for you?
I come because she's had a chest X-ray done and some blood tests at St Luke's.
Okay.
About just over 2 weeks ago.
Okay, so you're coming in for the results of the chest X-ray.
Yeah.
Okay, and why did we do the chest X-ray?
My mum's forgetting stuff.
Okay.
And she's seeing things and she's thinking there's people in her house and a little bit.
Okay. So let's just have a look. So we tested her for her diabetes.
Yeah.
So that's a bit more better than what it was. She's on tablets for it, isn't it?
Yes, she is, yes.
So I'll just go through the figures. So previously it was 59 last year and then it's 46. So that's what we would like it to be.
To be 40.
Yep.
Oh, okay.
So that's all okay.
Okay.
Chest X-ray didn't show any signs of any infection. She had a urine infection, am I right in saying
Yes,
that?
she did.
That's cleared up, has that?
I'm not so sure because I think the doctor had gave some tablets or something to take.
Yep.
She's been taking that, but not come back after that, so I don't know if it's gone or not. She has bought a urine test today.
Can I just test that urine?
Yeah, I think she's got it.
Oh, that's... Covered it up nicely.
She just bought it in a box where she keeps her medicine. There you go.
Thank you. I'm just going to quickly test it.
All right, darling.
Would you just quickly ask if she's got any symptoms of any burning, stinging or...
Any bisa belajar ni ubat tu cakap? Ni. Alright, then baru berjawab ni. No, she's fine with that.
Cleared up.
Yeah, it's cleared up.
So it seems to be clear.
Okay. You are our dearest.
You can, that's a new bottle.
Okay.
So
Yeah, I don't know
essentially
yet.
things seem to be okay. She's already been referred to the memory clinic, so you will get an appointment.
Okay.
We have to do all these blood tests and everything.
No, that's
before
fine.
that.
That's
So
fine.
you will get. an
I was
appointment
worried
for
because she walks off at any time at night. So
But if you've got any concerns, if that worsens in any way whilst you're waiting, let us know about it. Is that okay?
Yeah,
Is
that's
that
all
okay?
right. Yeah,
That's fine.
Yeah. Okay, darling. Thank you. Thank you. So everything's okay. Yeah. Thank you, darling. Really appreciate that.
You're
Thank
welcome.
you. Thank you, darling. Thank you.
Okay, Mrs. Patel.
Thank
Take care. Bye-bye.
There's a lot going on in terms of the symptoms that you described. I think it can be attributed to a lot of different things, but one of the things that I don't like is this food getting stuck, as well as some of the prostate symptoms that you've got. So I think definitely what we need to do is refer you to the specialist team if you're happy.
Yeah.
And what they do is they do a camera test just to see if there's a reason why the food's getting stuck. Is it because the food pipe's a bit narrow? Is there something else going on? Okay. And it will have to be as an urgent referral, okay? Especially with weight loss, we have to make sure it's nothing sinister. And by sinister, we mean the C word, is to make sure it's not cancer. And the only way to do that is refer you urgently, get this referral done. So you get seen, get everything done within 2 weeks, okay? I still think we shouldn't ignore your prostate. So I know you weren't keen on that examination, but that's okay. It's not, no one wants to do that examination, but it needs to be done, especially with the symptoms. Yeah. So what I'll do is I'll request some blood tests. We'll check your liver, we'll check your prostate, we'll check diabetes because that can make you wee a lot more. Okay. I'll ask for a sample of your wee as well, just to make sure there's no infection there, although you don't have any infective symptoms. And we'll check for calcium. All of those things sort of make you wee more. So it might not necessarily be the prostate, but we will check the prostate level as well.
Do I book an appointment when I go out from here?
What I want you to book in reception is the blood test appointment, and you need an examination of your prostate.
Well, I know from past, you're never able to get blood from me. I've always had to go down to St Luke's.
Okay, do you want me to print off a form for you?
Yeah, I think that'd be best, because you never seem to be able to get blood from me.
That's absolutely fine.
So I think I've got piles as well.
Okay. So everything is falling apart, is that what you're trying to...
Yeah.
Is that what you're trying to tell me? These are for St Luke's, for your blood tests, okay?
Thank you.
And then this is for a urine sample.
Yeah.
Still want you to go out in reception and book in for a back passage examination as well, okay?
So I make an appointment now.
Please, yeah, yeah.
Is that everything done?
That's everything, yeah. Thank you.
Right, thank you very
Thank you.
much.
Thank you. See you later, man.
See you later.
Bye.
Isn't it great that we won that award?
I think it's fantastic. First of many, I reckon.
I hope so.
Have you read that email we've got from Amia? I'm just looking at it now. Oh, practice of the year. What? Yorkshire GP Practice of the Year 2018. That's fabulous, isn't it?
These things are quite common. They're just a blocked grease gland, and we've got grease glands all over our body to keep us waterproof. Yep. So to remove it, what we would do is we'd numb it with an injection, cut over the top of it, shell it out, job done.
You all right?
All right.
Scratch and a sting. Here we go. 3, 2, 1.
You all right? You haven't even flinched, have you?
Okay. Just give that a bit of time. So you'll feel pulling and pushing. Okay, but it shouldn't be too sharp. Oh, it's right near the surface. Look at that.
You okay?
Yes.
Good. Sometimes they're quite deep, especially on backs, especially in men. But this is it's right at the top. We try and take it out in one, but very often they burst. But if you take it out in one, then you know you've got it all. Are you okay there, sir? You're not too uncomfortable?
Fine.
Such a thin wall thing.
I know, it's sort of pointing at me as well. So.
You've got the luxury of being able to move if you want to. How long have you had this one for?
I think now nearly 2 years.
2 years.
Oh, how you did it? All in
Oh,
one.
we've got it. Do you want to see it before we put it in the pot?
Yeah. Wow, it's like a ball.
Yeah. Great, and we've got it out of a tiny little hole, which is good. So the chance of it coming back is very, very low. So we'll send that off to the lab just to be absolutely certain it's nothing to worry about, but it certainly doesn't have any features that I'm concerned about. And put a couple of stitches in, maybe 3, and then we'll have you out of here. You need to keep this area dry
for how long?
24 hours.
24 hours.
So this time tomorrow, you could have a bath or a shower if you wish. And Karen's just going to come and put a little dressing on for you, and then we'll have you off of here.
I am here with dressing. Right. Don't top off this way, this side. Yeah.
All right, anything you want to ask?
No, I can book in the top here about the stitch removal.
Next Wednesday, Thursday or Friday.
Okay.
And just let them know it's for stitch removal.
Yeah.
They'll sort you out.
Okay.
All right, we'll leave you to it then, okay?
Thank you.
Thank you.
Most welcome, all the best.
Okay.
Right, super.
Thank you. See you. Bye-bye, son. Bye.
Thank you.
You're very welcome. Take care.
Okay, bye-bye. Thank you.
Right, thank you very much.
Thank you.
Ta.
Thank you. Bye.
See you later.
See ya.